On behalf of Children and Family Futures and the Family Drug Court Learning Academy, welcome to our webinar presentation. Special thanks to the Office of Juvenile Justice and Delinquency Prevention, who supports the National Family Drug Court Training and Technical Assistance Program. For more information about Children and Family Futures, the Learning Academy, and the Family Drug Court Training and Technical Assistance Program, please visit our website at www.cffutures.org. We hope you find this presentation helpful as you strengthen your partnerships and improve outcomes in your family drug court.
Hello, my name is Jane Pfeiffer, and I want to welcome you to our presentation, Ready, Set, Go, 5 Key Planning Decisions as you successfully launch your family drug court. This presentation will highlight 5 key planning decisions that your team will encounter as you plan to launch a family drug court, or FDC, in your community. For those of you who are already implementing an FDC, this presentation can also serve as a self-assessment and identify areas in which you may want to revisit or strengthen to improve your program. This presentation will also highlight a couple resources that your team will find particularly helpful. First, we're offering a team discussion guide that provides some questions to explore together after viewing this as a team or on your own. Second, the publication, The Family Drug Court Planning Guide, which was just released by the National Drug Court Institute and Children and Family Futures, is a valuable and comprehensive resource for any FDC team embarking on planning, implementing, or improving their program. You can download these resources on this presentation's webpage located on our webpage, www.cffutures.org. So let's get started. Number 1, using data to establish the need. Do we actually need a family drug court? First, community leaders should ask whether your community actually needs an FDC. Although the need to implement an FDC may be obvious and widely accepted, it's important that you take the time to collect relevant data so you can determine and demonstrate the necessity for an FDC in your community. This process will also identify what outcomes you are trying to improve. As a problem-solving court, FDCs are designed to improve specific outcomes for children and families affected by parental substance use involved in the child welfare population. These include treatment and recovery outcomes, outcomes related to child safety and permanency. Getting clear baselines on critical outcome measures will help you evaluate the impact or effectiveness of your program in improving the outcomes that matter most to your community. Understanding the need and problems you are trying to solve will also help your team understand the scale or capacity your FDC should work toward. In other words, what proportion of the total child welfare population affected by parental substance use will your FDC serve? Therefore, one important first step is determining the prevalence rate of child welfare cases that have parental substance use as a factor. For some jurisdictions, identifying this prevalence rate is easily available, while other jurisdictions will have more difficulty because of challenges related to screening, data collection, and reporting. But by using data, starting early in the planning phases, you will build your capacity to be more data-driven in all areas of decision-making during subsequent phases, including implementation, redesign, or improvement phases. Data will fuel your efforts in planning, demonstrating your effectiveness, and sustain your program by securing needed resources. Number 2. Establish a governance structure organizing the work. Another critical step in establishing a governance structure to organize all your planning efforts. FDCs rely on relationships, resources from multiple agencies and organizations to improve outcomes for children and families. These agencies, starting with the core 3 systems of the court, child welfare, and treatment agencies, and additional service providers in the broader community, have traditionally not worked together in a collaborative and problem-solving manner. Meaningful collaboration is complex and will take strong leadership and engagement from multiple levels, from directors and agency heads to program directors and unit supervisors to direct line staff. Why is governance structure important? Effective FDCs will need cross-system buy-in, representation, and investment. Leadership from all levels is critical to ensure decision-making powers and adequate communication flow. Critical functions are covered, including ensuring quality implementation, identifying and resolving barriers, and garnering resources. A governance structure also increases the likelihood of sustainability. The structure should include the following. The Executive Oversight Committee. This committee is comprised of senior officials or executives whose primary functions include final review of approval of policy and practice recommendation, planning for sustainability, and seeking external leveraged resources beyond the project grants. They also engage in communication with external agencies and policy leaders about the program, explaining its goals and intended outcomes. The planning team. This team gathers information, develops an operational plan, and evolves to resolve policy and procedure challenges that arise once the FTC is up and running. Because this team's purpose is specifically to set up an FTC, it will eventually disband after the planning phase is completed. The Steering Committee. This committee of high-level administrators oversees the planning process across agencies and has the authority to shape policies and practices for their organizations. The Steering Committee sets major policy directions, identifies and finds solutions to barriers, and secures resources for the FTC to ensure its sustainability. And the operational team. Led by a coordinator and a judge, this team will include members that will participate in weekly staffings and court sessions. This team works day to day in the FTC and involved in the coordination and delivery of services and monitoring progress of participants. The governance structure will be responsible for accomplishing critical tasks, including a planning timeline which will outline who will do what by when. This structure will identify the members of your steering committee and clarify who will provide direction and oversight. Identifying key tasks to serve as milestones and setting deadlines for those milestones is critical in maintaining momentum during the planning process to inform your team members on how often the planning team will need to meet and how much time they can commit. Completing these tasks will give you a timeline for the implementation process. Another critical step in the planning process is to build a strong foundation for your FTC through the development of a vision statement, mission statement, goals, and objectives. Vision. A vision statement defines the purpose of an organization and communicates an image of the future that draws others in and speaks to what they will see and feel. A good vision statement paints a mental picture by defining the desired future that an organization wants to achieve in 5 or 10 years, or even longer. Mission statement. A mission statement is a concise summary of what you plan to do, how you will do it, and who you will do it for. It's an organization's reason for existing. An organization's mission statement is the path that leads from the present to the future that the organization has described in its vision statement. Like the vision statement, the mission statement is a touchstone to guide the decisions and activities of your planning team and later of your operational team in its daily operation. The mission statement answers the what, how, and who. Goals and objectives. Goals are broad statements of desired outcomes that support the mission. They're usually a collection of related projects that shape your FTC programmatically and organizationally and clarify how you will achieve your mission. Establish your FTC goals to remedy the problems you face and to promote the outcomes you want for the families and children your court will serve. Objectives identify the specific, measurable achievements that support attainment of each aspect of a goal and help you to determine the programming and processes needed. Each objective can be monitored as part of quality assurance and measured as part of process evaluation. Target population. A clearly defined target population allows your FTC to focus on the community problems that the planning team, steering committee, and other stakeholders identify during planning. When defining your target population, you must also determine your eligibility criteria. Studies show equivalent or better outcomes in FTCs that serve individuals who fit into any or all of the following categories: previous child welfare contact, co-occurring mental health problems, unemployed, less than a high school education, criminal history, inadequate housing, risk for domestic violence, and methamphetamine, crack cocaine, or alcohol as primary drugs of use. The less exclusionary criteria your FTC has, the better chance that families who would benefit the most from your program entry will gain access. You may have to start with a small priority population and grow capacity over time to serve all families who could benefit from your FTC. Developing a plan in which your FTC becomes business as usual for eligible families is a commitment to systemic change that should be one of your program's long-term goals. Clearly, your planning team in partnership with the other parts of the governance structure have a lot to do. We want to remind you that failing to establish and maintain a strong governance structure will be setting yourselves up to fail. We have found that the most successful FTCs have active governance structures, but also we have found that many of the planning and operational struggles can be traced to governance structures that have failed to meet and accomplish their tasks and responsibilities. Number 3, Family Drug Court Structural Program Design. Determine your model. Another critical decision your team will face is the selection of a model. Integrated model. In the integrated FDC model, there is no separation of dependency and substance use disorder treatment issues. There is one judge who hears both the dependency case and the drug court matter. The FDC is embedded into the regular dependency dockets with integrated case plans, allowing the judge to respond to participant behavior in the context of the whole family and case plan. Challenges of this model include perceived problems with ex parte communication and judicial ethics. The scale of an integrated FDC may also be limited because of the need for time-intensive staffings, which include decisions about dependency matters as well as a review of treatment compliance. Parallel model. In the parallel model, the dependency case proceedings regarding the child abuse and neglect issues are conducted on a regular dependency court docket, and a different judicial officer hears the FDC progress reviews and manages the recovery aspects of the parent's participation in the FDC. The parallel model has the ability to serve a larger number of families because staffings do not include a comprehensive review of dependency matters. However, for the parallel model to be effective, it is imperative that information is integrated between systems and the needs of the entire family are met. Other key questions your team should consider when selecting a model include the following. Does the structure meet the needs of your jurisdiction and help the team ensure effective treatment, services to children, sharing of information, and shared accountability? Have all team members discussed shared principles or goal statements that reflect a consensus on key issues? Has the FDC team considered all of the benefits and challenges of each model in the selection process? And does the FDC team understand the importance of information sharing, regardless of the model selected? Number 4, setting the course for success. Develop processes for improved identification, assessment, engagement, and recovery support. As you plan for your FDC, you will need to design a systematic approach towards identifying families and ensuring timely access to assessment and treatment services and recovery supports. A systematic approach involves the development of clearly defined protocols and procedures with timelines and communication pathways. The time limit set forth by the Adoption and Safe Families Act, in which parents can achieve recovery and reunification, puts on pressure on systems to work together to set the course for success on behalf of children and families. Early identification refers to the earliest point possible in the child welfare response to allegations of child maltreatment and neglect in which parental substance use is a factor on the case. Before or immediately upon the filing of a dependency case in the family court, parents must be screened using an evidence-based tool to identify the presence of substance use as a factor in the case. Parents who screen positive for substance use as a factor require prompt access to further clinical assessment based on DSM-5 and ASAM criteria to determine the nature and extent of the substance use disorder, any mental health issues, recognizing that co-occurring disorders and issues can be expected. The planning team should begin to identify the scope of services that will be needed to address the multiple and complex needs of families, so appropriate services can be matched to meet identified needs. The planning team should also begin to develop agreements with partner agencies to ensure that clients have either priority or timely access to these services. One great strategy to plan for a systemic and timely response is the completion of a systems walkthrough. This process will help your team develop a good understanding of the system as it currently exists and identify any problem areas, such as inconsistency of referrals, delays in accessing treatment, lack of services or involvement of critical stakeholders, problems with engagement and retention, and lack of communication across systems. This process will help your team generate ideas about how your FTC program will improve these organizational processes. Please contact us if you want more information about conducting a systems walkthrough. A cornerstone of effective FTCs is the ability to provide increased recovery support and/or case management for families. The team needs to decide on an approach that provides more case management than a family would be receiving if they remained in the traditional dependency track. Possible increased case management models are the use of a dedicated child welfare case management unit, a child welfare liaison model, utilizing recovery support specialists or family navigators, or hiring a court case manager specific for FTC families. And finally, number 5, develop a plan for interagency training. Before you embark on establishing your FTC, you need to develop a plan on how you will ensure quality implementation across all your agency partners and educate community stakeholders of your FTC program. Partner agencies should have foundational knowledge of the principles of effective and quality treatment. This should include training on the use of engagement strategies for parents with substance use disorders, the relationship between trauma and substance use disorders, and the importance of trauma-informed interventions and trauma-informed approach. Evidence-based treatment approaches, including medication-assisted treatment, and cultural competency and gender-responsive approaches when working with specific client groups. Training should also include the importance of supporting families and the effect of substance use disorders and trauma on family relationships. Interventions that are family-focused while addressing the needs of each individual will be required. The effects of pre- and postnatal substance exposure on children and the need for children's services across developmental stages are also critical pieces to help your FTC become family-centered. Training should also focus on how to work together across multiple systems and agencies to better address the needs of families. It will be critical that agency training include increasing the understanding of each other's legal mandates, constraints, and goals, as well as effective methods of working together to form policy. One common area that poses a challenge for cross-system collaboration is the sharing of data and information. Cross-system training should include the policy and procedures regarding communication and how data will be shared and reported. Training should also explore values of each of the systems and its members and identify areas of agreement and disagreement and how values enhance or will challenge the capacity to collaborate. Tools such as the Collaborative Values Inventory have helped many family drug court teams. Please contact us if you would like more information. It is also important that your team develop a plan to educate partner agencies and community stakeholders of your family drug court. Be intentional about making periodic rounds, informing them about your mission, goals, and objectives of your program. It will be important that partner agencies and stakeholders understand who your FTC is serving, how to make a referral, the services they will receive, and how your phasing system works. They should also have an understanding of how information is shared, how parents are held accountable, and overall, how your program is designed to improve outcomes for children and families. The National Center on Substance Abuse and Child Welfare recently updated its most popular training resources, online tutorials for child welfare, legal, and substance abuse treatment professionals. Over 60,000 field professionals have taken these 3 tutorials, which now provide the latest best practice information on serving families affected by parental substance use disorders and child abuse and neglect. Each of these tutorials are offered at no cost, and continuing education units are available upon successful completion. The National Family Drug Court Training and Technical Assistance Program also launched the FTC online tutorials, especially geared for individuals who want to know more about the FTC model and essential practices. These are also self-paced and include multimedia resources to enhance learning. Peer learning is another invaluable way to support your planning efforts. We would also encourage you to visit a nearby FTC so you can learn about how other jurisdictions approach planning and operating their FTC programs. Nothing is more instructive for a new planning team than seeing an FTC live in operation, even if the host court does not resemble your jurisdiction in population, demographics, or other characteristics. The concepts underlying FTCs are similar. A coordinated, non-adversarial, and timely process by which a dependency case involving substance use by a parent is addressed while being judicially monitored and subject to increased accountability and drug testing, with coordinated substance use disorder and other treatment and case planning for both the children and parents. A site visit to an FTC will give your team the opportunity to observe the court environment, the judge's interaction with parents and children, the composition of the operational team, the staffing process, and the structure of the court. Ideally, representatives from partner agencies should participate in the visit to gain early buy-in and engage in essential learning. The National Family Drug Court Training and Technical Assistance Program also offers the FTC Peer Learning Court Program. These are model programs which have been especially selected because of their exemplary implementation of the FTC model in their communities. In addition to hosting site visits, they are happy to share policy and procedure manuals, memoranda of understanding, information sharing agreements, client handbooks, and other examples of policy and practice. Of course, there are many other key decisions you will encounter as you get ready to launch your family drug court. But as you take on this incredible task, it's helpful to remember the African proverb, if you want to go fast, go alone. If you want to go far, go together. Your planning process will require patience, persistence, and commitment, but we think it will be worth the effort if you do it together. For more information and continuing the discussion, please download the Team Discussion Guide and the Family Drug Court Planning Guide available on this webpage. For your information about these and other training and technical assistance resources, please contact us at fdc@cffutures.org. We'd love to hear from you as you carry out your vision for better serving children and families in your community. Thank you for listening.
Thank you for listening to our webinar presentation. To further your learning, please download the webinar discussion guide, which provides questions for your team to explore and next steps and resources to move your team forward. Again, for more information about Children and Family Futures, the Learning Academy, and the FDC TTA program, please visit our website, our Family Drug Court blog, or email us. Thank you, and we hope to see you again here at the Family Drug Court Learning Academy.